Democrats. Really proud to say tonight that this is the beginning of our third year for this series, and we could not have done it without all of your continued support. I also want to thank the new team that's coordinating the series along with me, and that's Sarah Smith and Jen Sinkler from Poweshiek County and Suzanne Kabish from Iowa County. It's really been great having them on board. Before we start, just a few housekeeping items. We're streaming live tonight on the Heart of Iowa Facebook page. I'll put the address in the chat room in just a minute. The forum will also be available tomorrow on YouTube. You can also view a transcript of this by selecting at the bottom of your page the live transcripts, and just click on view live transcript, I think is your option there, and you should be able to see the transcript on the screen. If you have a question this evening, drop it in the chat room by clicking the chat button on the toolbar. We're going to start with the questions that some people submitted in advance when they registered via Zoom, and then we're going to take as many of the chat room questions as possible. So ask whatever you want. Also feel free to drop in the chat room any suggestions for future speakers or issues or topics that you would like discussed on a Heart of Iowa event. Tonight, our forum focuses on food insecurity in Iowa and on the Supplemental Nutrition Assistance Program, which is commonly known as SNAP. This program helps people put food on the table and get back on their feet after tough times. The Senate Study Bill 1105 would kick Iowans off of SNAP, though they are eligible, by putting up unnecessary red tape and creating more cracks for families to fall through when seeking food assistance. We have 4 panelists joining us tonight to help us better understand this legislation and how it will hurt our neighbors and what we can do to help out. I'd like to welcome our moderator for the evening, Senator Sarah Trone Garriott. Just a little bit about her. Sarah grew up in northern Minnesota and is a pastor with the Evangelical Lutheran Church of America. She came to Clive as a pastor, and currently, in addition to being a legislator, she is the director of the Interfaith Engagement of the Des Moines Area Religious Council. That's a long name. She was elected to the Senate in 2020 for the first time, but because of redistricting, she moved, I think, to Waukee, if I'm correct, and then had to run again in 2022. That was a great race, and she won that race, which was terrific, and now represents District 14, which covers Van Meter, Adel, parts of Clive, and West Des Moines. In the state Senate, Senator Trone Garriott has focused on helping working families, good schools, clean water, quality, accessible health care, economic opportunity, and civil rights. I'm going to turn it over to Sarah, and she will speak a little bit and then also introduce our other guests. Take it away, Sarah.
Hi, everybody. I'm Sarah Trone Garriott. And so every legislator has an area that is close to their heart, something they know a lot about. And for me, one of those issues is food insecurity. I've worked for the Des Moines Area Religious Council for almost 6 years now. And I've learned a lot about some of the challenges our neighbors are facing. And I wanted to bring that insight to the Capitol because I saw a lot of bad legislation passed by some folks who seem pretty out of touch with what was going on in their neighbors' lives. You know, at the Capitol, we have a lot of legislators who are independently wealthy, people who are retired and pretty comfortable in their lives, or they have businesses that they can leave so that they can serve at the Capitol for 4 months of the year. To be able to serve in state government, you have to have some privileges. And for some folks, they don't know what it's like to really struggle financially. And we're seeing that in some of the legislation that's being passed. So we've got 3 panelists with us tonight. And so I'm going to ask each one of them to introduce themselves, who they are, what program they work for, and how that program connects with the issue of food insecurity. And so Natalie, I'm going to ask you to start us off and share about yourself, your program, and what your work has to do with food insecurity here in Iowa.
Thank you so much. Thanks for having me. My name is Natalie Veldhouse. I'm a policy advocate with Common Good Iowa, and I'm on the board of the Iowa Hunger Coalition. I've been doing state level SNAP policy advocacy in Iowa for the past 5 years. And before that, I worked in food pantries and schools in Eastern Iowa. And so at Common Good Iowa, we do policy analysis and advocacy on a range of policy issues like safety net, including Medicaid, childcare, labor issues, environmental policy. And the through line between all of these areas is really tax and budget work. And so in my work, I try to follow as close as I can what's going on in the legislature and work to mobilize advocates across the state to engage on SNAP issues. And I also do some work on Iowa Kids Count. So really thinking about how policies are impacting children. I'm trying to think if there's anything else I want to share. Work very closely with Luke on the Iowa Hunger Coalition. I think I'm going to just stop talking because there's plenty of other folks to speak.
Well, then I think we should probably go to Luke next, and he can share about how you all are connected and the work that he does.
My name is Luke Elzinga. I am the Policy and Advocacy Manager at the Des Moines Area Religious Council, DMARC. I'm a colleague of Sarah's. I also serve as the board chair of the Iowa Hunger Coalition, which is a statewide advocacy group focused on ending hunger and food insecurity in the state. The way my work connects with food insecurity at DMARC, we have a food pantry network in Polk County. We assist around 20,000 people every month through that food pantry network. And we know that anytime SNAP benefits are reduced or and further administrative hurdles are created around the program, we see more people at food pantries. Right now, only about 40% of the people we assist actually are receiving SNAP, which tells me both that there's a lot of people who their SNAP benefits just don't go far enough. And there's a lot of other people who experience food insecurity and aren't even able to receive SNAP, whether their income is too high. They maybe have received SNAP in the past and the benefit amounts were so low that they've felt like it's really not worth it. And there's a lot of stigma around the program still. And there's stigma around using food pantries as well. I think a lot of people feel experiencing food insecurity in the state. It can feel very isolating, especially when our society is sending the message that, you know, people are experiencing poverty because of some choice they've made or moral failing. And we know that's not the case. We know that hunger and food insecurity are systemic issues that tie into so many other issues like low wages, lack of affordable housing, lack of affordable childcare, healthcare. All of these things tie together with food insecurity. And so that's why a food pantry network has someone on staff doing policy and advocacy work, because we're serious about, you know, putting ourselves out of business. And part of that is making sure that we are having policies in the state that really support our families as they're struggling. So sure, I've got lots more to say, but I'll end there for now.
Thank you so much, Luke. And Kim, share with us about who you are and the work you do, how that engages with food insecurity.
Well, good evening, everybody. My name is Kim Guardado, and I am the director at the HACAP Food Reservoir. So we are the food bank that serves Eastern Iowa. We have 7 counties, mainly the Iowa City, Cedar Rapids area and kind of the rural counties surrounding there. We are part of the Iowa Food Bank Association, which is the network of food banks that serve the entire state. So certainly the work that we do is work for food insecurity. Personally, I've been at HACAP for over 20 years, and I've spent most of that time working in our health services with WIC, child health, and maternal health. And then I moved over to the food bank about 4 years ago. And as a nurse, I feel like this is the right place for me to be, to advocate for those. Everybody's healthier when you're eating better. And so as a food bank network across the state, we are really committed to doing what we can to feed people today and hunger tomorrow. And so like a lot of the things that Luke mentioned, as far as the social determinants of health, like we're doing a lot of things to work to feed people, as far as food rescue or TFAP, the Emergency Food Assistance Program. Those are commodities that are coming from the USDA. We also do a lot of food purchasing. But really, all of that, kind of what I always say is we're not going to end hunger by feeding people. So we have to look at all of those other root causes of poverty and because our food bank is in a community action agency, we're well positioned to be able to do that. And so we've really been focusing a lot of efforts on nutrition programs to have healthier food, but also some of those ending poverty that ending poverty work. One example is we have a social worker who goes to food pantries and does social determinants of health screening and mental health screening, and then makes those referrals out into the community, because there are so many people that are facing food insecurity that are new to having that concern. Like, they've just never had to face this before. The downturn in the economy, the inflation, all of those things are pushing people to the limit. Income is difficult, and people are really struggling. So we're definitely seeing a large amount of people that are new to being able to ask for help or to go into a food pantry. And then certainly with SNAP, as was mentioned, there's barriers, there can be challenges with that. So, we're just trying to do what we can to educate people about that there are programs out there and how we can all work together. I spent the day at the Capitol today for our Day on the Hill for hunger awareness. And just, there's a lot going on. So Sarah, I definitely feel for you and the work you have in front of you, and you face that every day, which is, there's a lot of things happening and it's moving very quickly. And so thank you for having me, and certainly any questions about our food bank system and how we, work to feed people across the state, I can always talk more about that if people have questions.
Thanks. And so if you haven't personally experienced food insecurity or hunger, that you might not know what that looks like here in Iowa. We have a lot of folks in the state who have an idea of what food insecurity looks like based on harmful myths, stereotypes, things they hear in the media. But, can you help the folks on this call understand what's going on in Iowa with food insecurity, what the landscape looks like? And Kim, would you be willing to start us off and tell us, what do you see in your part of the state with food insecurity?
I think that we get that question a lot. And I think the thing that I'll say is that the family or the person facing food insecurity looks like each one of us. It's certainly, we're seeing a lot of seniors, an alarming amount of seniors that are facing food insecurity. Families with children, about 2/3 of the people on SNAP are families with children. And so, they're working. There's one or two parents are working, there's some children. And I think that's the biggest myth that I guess I'd like for us to move past is the person on SNAP is anybody. They look just like us, and they're at their grocery store buying groceries just like we are. And so I think that's important to think about. It's not, yes, there are people that are homeless. There are people, whatever situation you want to say, that's all true also. The majority of the people on SNAP are regular working folks just trying to make a living.
And I think it's really important for people to realize that these are our neighbors. They could be friends, family members. They could be us at some point if we run into a challenging time, to help understand that this isn't someone else's problem. It's something impacting a lot of people in our community. Luke, would you share a little bit from your perspective of, what's going on with food insecurity in the state of Iowa?
Yeah, I would definitely echo Kim and that we're seeing a lot of first-time food pantry visitors right now. And this is something that I've been bringing up with legislators around these bad SNAP bills, but we've got food banks and food pantries across the state that are setting records or setting near records. And at the same time, SNAP enrollment is at a 14-year low in the state, which tells me that we should be doing a lot more to improve access to the program rather than creating additional barriers. Something that you may have seen in the news this week is that nationally, SNAP benefits are going back to kind of pre-pandemic levels. There were these emergency allotments. We actually lost those last April in Iowa. They were tied to the emergency proclamation. And following that drop in SNAP benefits, we just saw huge increases across our food pantry network. And a lot of people turning for the first time. So I think it's kind of been this perfect storm where we've lost SNAP benefits. Some of those things Kim mentioned around rising food costs. There's a lot of people struggling right now. And, we know through our data at DMARC that everyone experiences food insecurity in terms of our community. When you look at suburbs, there's food insecurity everywhere. But when we look at our data, we also know that there's some clear racial disparities that exist when it comes to hunger and food insecurity. And Black and Brown Iowans experience food insecurity at a higher rate than white Iowans. And as Kim also mentioned, we've got a lot of children and seniors on the program. SNAP really is there to protect our most vulnerable. But there's also a lot of people who are working and still not making enough to get by that benefit from SNAP and from food pantries. I'll leave it at that.
Yeah, thank you, Luke. Natalie, share a little bit about what you're seeing happening in the state of Iowa with food insecurity.
Yeah, I've been doing like kind of strictly policy work for a while. So I've been away from working in pantries directly. But to me, when I think about food insecurity in Iowa, I feel like I zoom out quite a bit and go back in time, like even, what is this now, like 5 or 6 years ago, I think of how in 2017, Iowa passed a law that preempted local minimum wage increases. When 4 counties increased their wage, and other policies like gutting collective bargaining rights. And even this is, not as connected to SNAP, but changes that we've seen to our tax policies, like flattening our progressive income tax, and just thinking about how those things are all related to hunger. And so I think it's important to touch on some of those pieces because they're all policy choices. Poverty isn't an unfortunate accident, it's a policy choice, and we can make a different choice. And I also wanted to add, kind of connected to what Luke was talking about, at Common Good Iowa, we've done an analysis of our state's cost of living over the past 12 years. And our 2022 analysis showed that statewide, 1 in 7 working households were unable to meet basic needs. That's 114,000 Iowans based on just income alone. We're a low wage state, even compared to other Midwestern states. Missouri, Nebraska, both have higher minimum wages than we do. So I try to always just remind folks that, this is a policy problem. And we're seeing that unfold right now with Senate Study Bill 1105 and House File 3. So I'm going to stop so we can talk more about that.
All of these folks, I haven't gotten to meet Kim before, I don't think, but I know that all of these folks have a lot of information, a lot of knowledge about the issue. But not everyone does. And so I want to do something I should have done at the beginning, is define food insecurity, because sometimes people think that it looks like hunger, that you are physically hungry, you don't have enough to eat. And that's sometimes the case when people are skipping meals and going without to get by. But more often than not, you see people eating the wrong kinds of foods to feel full. Cheap, high calorie, low nutrition foods just to feel full and get by, which means that they're experiencing other issues, health problems related to not having the right kinds of healthy food for their bodies to function properly. And then it also means not really knowing where you're going to get that assistance from day to day, from week to week, from month to month. And so it's that uncertainty of not knowing where the help's going to come from. So all 3 of those pieces are part of the idea of food insecurity. So that's why we don't, we'll talk about hunger sometimes because that's something everyone can relate to, but it's a little bit more than that. And that also speaks to what some of the solutions are. They're not just feeding people, like Kim said. There's a lot of other things that go into addressing this issue. So I'd like to hear from you all. I definitely have opinions about why some of the legislation we're seeing right now, House File 3 and Senate Study Bill 1105, are not good for Iowans. Can you share some of the problematic things about the bill, because I know that people have heard about it early on in the process. House File 3 got a lot of attention because of a particular part of the bill. Legislators had no idea what they were signing on to and said, sure, we're going to limit people to the WIC list, which meant they couldn't buy fresh meat and a whole host of other healthy foods, which was ridiculous. And so that got a lot of attention, but that's not really the biggest problems with the bill. Luke, do you want to kick us off?
Yeah, and I mean, there's a lot of problems, so thankfully we got three of us to cover it. I will maybe focus my attention on, so from my opinion, probably one of the most harmful pieces is establishing an asset test for SNAP in the state. So currently Iowa is one of 36 states that does not have an asset test for SNAP. And that was not the case around 20 years ago. There were just a few states that started doing it. We really saw a shift in states getting rid of asset tests because they were found to really cost more than they actually saved. So the original proposal would have been an asset limit for a household on SNAP of $2,750. It was a little bit higher if you had a member of your household who was a senior or had a disability. We did see an amendment to both the Senate and the House bill this week that would increase that asset test or the asset limit. So households would now face a $15,000 asset limit. It's a whole lot better than $2,750. And the value of one vehicle is fully excluded, and up to $10,000 in the fair market value of a second vehicle is excluded. And that was new. So I think there's been improvements, but the point that we have been making the entire time is that by having an asset test, you are going to have people who fall off the program who fell well below that asset limit, but couldn't meet the additional administrative hurdles and reporting requirements. An example that we've been pointing to is the state of Pennsylvania tried this in 2012 and then reversed course 3 years later because they found that it was costing them more money than they were saving. They also found in that first year of having that asset test, there were 4,000 households removed from SNAP because they exceeded that asset limit, but there were another 110,000 households who got kicked off the program simply because they could not meet those additional reporting requirements. There's plenty of quotes out there from folks with legal services who were trying to help people and they couldn't, get that fair market value of the vehicle in time or different financial documents to prove these assets. And that is really what's at stake with the bill. We're creating more additional administrative hurdles that people need to jump through, more paperwork they have to turn in, and people are going to fall off the program. People who are eligible for SNAP right now are going to lose access because we're adding this asset test. And I think that, in my opinion, is one of the worst pieces of the bill.
Natalie, do you want to share some of your concerns about the legislation?
Yeah, I'm trying to think. I have many concerns. I'll just add that there are other elements of the bill. I think there was definitely something about the WIC language where people were really fired up about it because it felt tangible and it made people really angry, understandably. But I think some of the other pieces of the bill, they just sound really technical. They're like a little harder to mobilize people around, like extra eligibility verifications. It's increasing the number of data points that the department is collecting from families and increasing the frequency with which they're collecting all of that information. And then also having a survey that's making sure that you absolutely super duper duper are who you are, even though there are already eligibility measures in place. This is all just extra stuff. The department already does all of these things. And they've taken a lot of measures in the last few years to really improve all of these systems. I think one other piece that is a huge red flag for me is now that WIC language is gone, we now have a candy and soda ban. And to me, that's a non-starter, like we've been talking about all night. food insecurity is poverty, it's an economic policy issue. So tinkering around with what families are and aren't able to spend their SNAP dollars on is not doing anything about poverty or any of these other issues. And what's difficult about it is there's this other program called Double Up Food Bucks, which is super important. It doubles the value of SNAP dollars spent on fresh fruits and vegetables to a certain extent in certain grocery stores and farmers markets. And there's $1 million appropriation for that, which is fantastic. Folks have been advocating for that for years. And at the same time, that money is only going to come through if the candy and soda ban is accepted as a waiver through the USDA. And the USDA has demonstrated in other states that they're unwilling to really tamper with what folks are able to buy with SNAP. So in a way, it's almost like that Double Up Food Bucks appropriation isn't there because we know that that waiver will not be approved. So that's upsetting. There's also some Medicaid work requirements stuff in there. I'm not going to get super far into that, but again, there are work reporting requirements. There already are work requirements, and a bunch of studies have shown that work reporting requirements are not effective at connecting people with living wage work and affordable healthcare coverage. So sorry, that was a lot, but there's just there's a lot going on in here.
There's a lot in this bill, and a lot of it is not very good. Kim, any issues, concerns you have with the legislation?
Yeah, what I'll just add to that, I think you guys summarized pretty well. I think that what I'll just add is that the reminder that the SNAP program is federal legislation with federal dollars that come into our state. So money that's coming into the SNAP program supports our economy in our state. It supports the grocery industry. It supports our local growers, all of these things. So why would we want to decrease the amount of money coming into our state? And then the other piece of that is the administrative. So the state and federal share 50-50 the cost of the administrative. So when we add additional administrative burdens to this legislation, that's a cost that we're going to have to incur to our state. And there isn't a fiscal note attached to this. So there hasn't been cost assigned to it, which we know there will be great costs to implement all of these things.
Yeah, so just with some of the financial pieces Kim brought up, every month in Iowa, we get about $43 million of SNAP federal dollars coming into our state, spent at local grocery stores. And it generates more economic benefit than that. It's usually 1.6 if you multiply it times that. So it'd be more like $70 million a month worth of economic value in our state. And Mary had a question in the chat about, well, if it's a federal program, how can our state disband it? We're not disbanding it. We're just making it really hard for people to access. And so, like Luke mentioned, folks will just be discouraged from applying. They'll get only partway through the process and give up. That's the real risk of this program. No matter how high they set the asset limits, having to go through that process to get $40 a month for your family to get SNAP benefits isn't going to feel worth it to a lot of people. And so they won't. And that means they won't have access to the healthy food that they need, which is a real problem. So we've got some questions from the community here. And so one of the first ones has to do with SNAP specifically. It's a personal experience from Shelley. She knows a couple who are receiving SNAP. The wife got a job 15 hours a week, and then their benefits were cut to $23 a month. If both adults are required to work 20 hours a week, will they qualify at all if there's work requirements? Let's see, Luke, maybe you can answer that one.
Yeah, I can hop in. So it's hard to say just not knowing all the specifics. But $23 is the minimum benefit. And so I would guess that any additional income would likely probably kick them off the program. We actually saw this happen in January. Social Security benefits saw an increase, and then a bunch of people on SNAP either lost access to the program or their benefits were reduced. So it's like anytime you get one step ahead, it seems like there's one step back. What I would say is there are kind of two sets of work requirements for SNAP. There's kind of the general work requirement that says if you're between the ages of, I think it's 16 through 59, and not if you're a student, if you're 16, it's not high schoolers, but if you're out of high school, you basically have to actively be looking for work, be registered for work. You can't voluntarily leave a job, things like that. There's a stricter work requirement for what's called able-bodied adults without dependents. And this is really people between the ages of 18 and 49 who do not have a dependent in the household and do not have a disability. And those folks need to be working at least 20 hours a week, or they can only receive 3 months of SNAP benefits every 3 years. It's called the ABOD time limit. That actually has not been happening because of the pandemic, but those work requirements are coming back within a couple months. So I think I guess to answer the question, I think it'd be very likely that those people would probably lose access to SNAP benefits. There's also a piece in the House bill. I'm not sure if it's in the Senate bill, but it actually makes it mandatory for able-bodied adults without dependents to participate in the SNAP employment and training program. Doesn't say people who aren't working. It says all able-bodied adults without dependents. So there's a big question mark there of, are we going to be making people register for this employment and training program, even if they're already working? Are they supposed to do that on top of their job? So now I'm getting away from the question, but I guess what I would say is those stricter work requirements are coming back soon. I think a lot of people will be affected. And like Natalie mentioned, these work requirements really, research does not show that they move people toward meaningful employment. It really just kicks people off the program who can't meet the requirement.
So we have not so much a question, more of a comment coming from Mike, but I think he's expressing some frustration over this legislation, which a lot of folks are. Are we not obligated to care for those who are less advantaged? Is this not part of being a civil society? Where are their morals? And trying to understand where folks are coming from in pushing this legislation. I heard a lot from my Republican colleague in committee this week saying this was streamlining the process. Are there any other perspectives that you've heard as justifications, and what do you think about those, Natalie? Do you want to share a little bit?
We've heard a lot of things. We've heard that we need to pass these bills so that we can make sure that millionaires aren't receiving SNAP in Iowa, that folks with jet skis aren't receiving SNAP. We hear that it's going to make sure that only the truly needy are accessing the program, which is a really frustrating talking point. Because like Luke was expressing earlier, in my mind, I'm like, oh, we want to make sure people who need the program are on it. Cool. Let's expand eligibility. Let's grab that other 60% of folks who aren't being served by SNAP but visiting food pantries. I'm trying to think of the other juicy ones. I think it just aligns with a lot of other messaging and framing I've heard on issues about, we should cut SNAP. It's framed as like an opportunity for folks. Like I remember there was a bill maybe a session or two ago where they were like, we're going to shorten polling places hours and it's an opportunity. Just like, how is that an opportunity? So yeah, it all just plays back into the frame that folks who are using food assistance either don't deserve it or they're lying, or and they really they overshoot, they really fall on this like fraud argument, but fraud is like hardly any SNAP fraud happens in the state of Iowa. I think I'll stop there because I could just keep rattling, but the millionaire piece just really gets to me. Apparently there was someone in Minnesota who was a millionaire and applied for SNAP and got it, like just to like as a gotcha. And I think that's part of what they're referring to, but it sounds like an unpleasant person.
Kim, are there any, I don't know, just harmful myths or talking points that you're hearing in defense of this legislation, because you were at the Capitol today.
I was at the Capitol, and all the things that Natalie mentioned were exactly what we heard today. I think the fraud point is really important to mention, that it's such a low rate of fraud that are we going to save enough money to pay for what it's going to cost us to monitor that? So I think that's the question. So I think there just needs to be continued education to people that are making these decisions, to make sure that everyone really understands that this is federal money. The fraud rate's already low. We've got a great program. People need help, kind of that. We just need to continue to educate people, because I don't think that everyone understands what this really means and what the implications, the unintended consequences of some of these things that are going to happen to families. And then the next step of that is, okay, so this happens, and then there's going to be a greater need. Like Luke was talking earlier about the increase in need that we're already seeing. And now we need to help even more people, which we are happy to do that. But we're also seeing, across the state, we've seen such a huge decrease in the amount of commodities coming from the USDA. We're seeing a decrease in donations that are coming from large corporations and retail rescue. Like there's less food to donate because the inflation costs, stores are wanting to lose less money. That, like, there's so many factors all rolled up in that. And so we're not, our charitable food system outside of SNAP is not equipped at this moment to handle the need that we're going to see. And that's the part that probably strikes to my heart the most. Like, I want people to be able to eat. I want them to eat healthy foods. I want people to be healthy. And as we, everywhere you look, there's nutrition messages, and we've made so much progress in having healthy foods available in food pantries and available across the state. And I just feel like we're going to take steps backwards, and families are facing enough challenges. Not that there's ever a time, but this certainly isn't it.
Thank you. I tell people all the time that the food pantry network that I work for, we work to be as efficient as possible, but nothing will be as efficient as giving people money to go buy food at their grocery store. Not having to make an extra trip, not having to have this whole system set up to get the food, move it around. And you named a number of reasons why that's getting harder and harder for food banks in particular. And that's going to make it really tough on food pantries that are meeting the need for folks. We did have a couple questions come in that were about breakfasts and lunches at schools. And so, not part of this legislation, and there have been legislators who have proposed bills to try to provide universal free breakfast and lunch at schools. We had that for 2 years during the pandemic. And some schools are still providing that, but not all anymore. Is there anybody on the panel who wants to talk about that issue? Go ahead and wave your hand. Luke, go ahead.
I guess I will kind of be brief, because this Healthy School Meals for All is a piece that's on the Iowa Hunger Coalition's advocacy agenda. We were trying to find a Republican sponsor to introduce that bill, and could not find one who was willing to do that. We did see the introduction of Senate File 303. I think it was Senator Weiner and a few others signed on to that. That would provide free breakfast and lunch to all Iowa students. It's actually not just public schools, it's any school that participates in the National School Lunch Program. So that would be some private schools as well. I think it's highly unlikely we see any movement on that, because the Republicans do not have an appetite. But thankfully, we did see a bill introduced. We've got one that we can point to. We can keep educating folks. This is something that's happening in other states around the country that are moving in this direction. We've seen other states do this. We saw a ballot initiative in Colorado. There's other states working on legislation right now. It's an incredibly popular program. There's been polling done. you know, between Republicans and Democrats and the public, it's something like 74% or some ridiculously high number. Like, it is a very popular policy. It would have obviously a big price tag, but it's an investment. We're talking about children's nutrition, and we know, especially in the first 5 years of life, that has a lasting impact on the rest of someone's life if making sure that they have proper nutrition. It's an investment in the future of our state. Unfortunately, this year, I don't see it happening, but we're going to keep working on it.
Thank you so much, Kim or Natalie. Do either of you want to say anything about school lunches? Luke has said it all. All right. So we've heard about, you know, what's happening here in Iowa. We've heard about some of the challenges we're facing. What can these folks do to make a difference in their communities? So Kim, we'll start with you. What can they do? What are some calls to action?
I think the first thing is that you need to talk to your legislators. Like, you know, I've been doing this work for a few years, and a big portion of that was COVID. So I'm really fairly new to the advocacy world. And you know, one of the things that I learned in preparation for the day on the Hill today really is they're people just like we are. And the best thing, one of the good things that happened, I was riding up the elevator, and the person I was in the elevator with was one of our local representatives from Cedar Rapids. And we just had an amazing conversation that was very human to human. I guess I feel like it wasn't a food bank director to a legislator. It was a human to a human. So I think that's the most important thing, is that these are all humans that either they're not aware of the implications of some of the things, or they think differently about how to accomplish goals, which I think that's one thing that, you know, we all, feeding people is not something that is hugely controversial. You know, typically it's supported. It's just how you go about it that is looked upon a little bit differently. So I think the message that's important to send is, if you have a personal story, like that's what makes a difference, is you put a face to the story. It's your neighbor. It's you when you were a child. It's whatever that story is. I think it's really important to share that story in a way that speaks to another human, that says, this is okay, or this is not okay. And this is how we can make a difference for that child. That's I think the big piece. And you know, there's a lot of ways that you can contact the legislators. Certainly email is the easiest, because that's, you know, you send an email. And I think maybe Sarah, you can tell us more about how do you want to be contacted, right? But I think they need to hear from us, whatever the issue is. When they don't hear anything, they feel like, oh, okay, well, this must be fine then. And I think sometimes it's easy to get frustrated, or like, you know, ask questions like, how can this be happening? But what we really need to remember is that we have to just continue to educate people.
Thank you, Kim. Natalie, what can people do?
Yeah, I would echo, you know, calling, emailing your legislator, especially, I know the Iowa Hunger Coalition, and by that I mean Luke, really puts out really fantastic action alerts when, you know, that there's a really crucial moment coming up on specific bills. So if that's not a listserv that you're a part of, you can join that on the iowahungercoalition.org. And I would say also, I mean, this is definitely a longer term solution, but talking to people in your community, like talking to your family, like I can think of a few family members that I should sit down and talk to have those discussions about root causes of hunger. And I would also say, like, another more tangible way, I mean, this isn't going to change any laws, but, you know, making recurring financial contributions to our food banks and our food pantries, or, you know, if you don't have financial donations that you can give, you know, like volunteering to clean out a local community fridge, you know, once a week or something like that. Because like we're saying, you know, if this is passed, it's really going to hit pantries and food banks hard.
Thank you, Natalie. Luke, what can people do?
would just echo, reach out to your legislators. I am going to post a link in here. This is the Iowa Hunger Coalition SNAP Map tool. It has the latest county level SNAP statistics. So you can kind of look up and find that information when you're talking to your legislator. We have a Protect SNAP page on our site that needs to be updated with the new bill language, but we haven't seen the kind of amended language yet. But if you sign up for our newsletter, we'll be sending an email out Friday that has some of those more of those resources. And I think kind of like Kim was saying, like, just remember, all of our legislators are humans. They're they're just like you in a lot of ways. And I think sometimes I have definitely had times where I'm like fired up and like ready to give someone a piece of my mind and just need to like take a few breaths and assume best intentions. This happened a lot around that WIC list because people frankly did not know what they were signing on to. We have a lot of freshman legislators this session too, who might have very little knowledge about SNAP. And this is an opportunity to educate people. And if you go in guns blazing, like they might just shut down, not do well with that interaction. And that could affect their perception on whether they're going to vote for that bill or not. When we had the vote on the House version, House File 3, there were actually 2 Republicans who broke rank and voted against that in committee. So I think especially on the House side, we are going to be pushing hard to make sure every single legislator is hearing from people in their district about the harm that this bill would cause, because it is a lot of unintended consequences. And like Natalie was saying, if you're just looking at the language and thinking, oh, yeah, people with more than $15,000 shouldn't have SNAP, and not understanding how that policy is actually going to impact families, you just don't know. So again, really encourage you, maybe be a little soft in the approach and use it as an educating opportunity to let people know how people in their district are going to be impacted. Yeah, guess I'll just leave it there.
Thank you all. And something that I say to folks, I do a lot of education for the Des Moines Area Religious Council Food Pantry Network. And one of the most important things people can do is learn about the issue and learn about the folks who are doing the work in the community. And so thank you for doing that tonight, spending the time to learn. It's really valuable because now I hope you've gained some insight. You've met some folks who can, you can connect with in the future. And I hope it motivates you to get involved with hunger fighting organizations in your community, because, we need to be thinking at all levels. How can we meet people's needs right now? How can we think about big picture policy? Some of these battles are, short-term things that we can work on, and some is a long-term effort that's going to take years of working and trying to change hearts and minds, to help people understand what really works, what actually is going to make a difference, and what's truly going to, address not just food insecurity, but those underlying causes, poverty and transportation and childcare, and many of the things that Natalie and Kim and Luke have mentioned. Because it's all connected. And one of the great things about volunteering or getting involved with a local organization is you get to meet your neighbors, and you get to understand how this is playing out in your community. Let's see. And I am looking back to see. So Mary asked about the folks, the legislators. They're people, but are they being forced to party think? Well, there's a lot of pressure to get along, I'm sure, right now. We know that the governor primaried some folks who didn't agree with her policies, and everyone seems to be getting on board. And there's definitely benefits that come with it. we've seen some folks in the House who have spoken out against different policies, who've been stripped of their community assignments, who are kind of on the outs with leadership because of speaking out. But you never know what's going to connect with somebody. And, there may be those folks that they've got some experience or some issue that you can really connect with them and they will be an advocate. Just one example, we've had a number of bills about medical malpractice, and then there's a trucker tort bill that limits caps on damages when somebody's been killed or injured by a truck driver for a commercial fleet. And we have one Republican legislator who is offering amendments and voting against these bills, even though the rest of his party is going a different direction because he had a personal experience that has changed his mind on that. You never know when something's going to connect and land. And so, it's important to keep trying. Yeah. Oh, yeah. And Luke, you had a comment for that as well. Do you want to share?
Yeah, I mean, you make a great point, Mary. Like, yes, we can try to influence individuals, but a lot of the time it does come down to people towing the party line. And I just posted the example of why we had 39 folks sign on to House File 3 back when it had the WIC list piece that would have banned fresh meat from SNAP. People didn't understand what was in the bill and signed their name on because it was a leadership bill. And I hope for a few of those freshmen, it was a learning experience to read the bill and understand what's in it before you put your name on it, because people were outraged, and rightly so.
Yeah. So thank you all so much for being with us tonight. I'm going to turn it back over to Kathy.
Kathy, you are muted.
Sorry about that. Want to thank Sarah and Luke and Natalie and Kim again for joining us this evening. Very helpful. I learned something. I hope everybody else did. I did drop in the chat room. If you don't know who your legislators are, there's a Find Your Legislator link in there and you can look them up. I also want to thank again the Heart of Iowa team and Genevieve Johnson, who's always here to help us in case anything goes wrong technically. Just a quick reminder that the recording of this event is available on our Facebook page and will also be available on YouTube probably tomorrow. I want to take a moment to advertise our April event. We're getting very ambitious, and we've decided to host a 4-part weekly series starting on Wednesday, April 5th, and continuing on each subsequent Wednesday through the end of April. The series will cover different aspects of climate change with experts on a range of topics, including air, water, pollution, impacts of climate change on soil, and how all of this is already affecting us and will continue to impact Iowa's ability to grow healthy food. We hope you'll join us for this deep dive into those issues that affect all of us. We're just in the planning stage on this, so we'll keep you informed as we go, but the first one will be April 5th. Before signing off, I'd encourage you all to donate to your county Democratic Party, the Iowa Democratic Party. These all have ActBlue accounts usually, and if you'd like to donate to the Heart of Iowa Dems, I will drop that link in the chat room in just a minute. Unless there are any other questions or comments from the Heart of Iowa team or any of the panelists, I'll wish you good night. Thanks for keeping this series going, and we'll see you next month.